You guys, it's Wednesday, and you know on Wednesdays we work out a practice question. This week's question states, a 35-year-old patient presents to the office for follow-up. As the nurse practitioner reviews the patient's lab work, she notices the abnormal lipid panel. The total cholesterol is 250, the LDL is 120, HDL 42, and triglycerides are 556. How should the nurse practitioner treat? So we look at that stem of the question first. So we're looking to see how we should treat an abnormal lipid panel with these findings. So various factors can go into play. I know in practice there's various other things you want to look at, but for testing purposes, I want y'all to focus in on this lipid panel and how we treat. And I like to design questions to train your mind on this so you're applying what you need to apply so that when you see it on boards, you will eliminate all the fluff in the scenario and zone in on what's truly being pointed out, okay? So again, let's look at the lipid panel. So the total cholesterol is 250. That's too high because it's greater than 200, correct? The LDL is 120. We want it less than 100 unless they have, cardiac disease or two or more comorbidities. So in this case, it's still over the 100. The HDL is okay, and the triglycerides are 556. So that's elevated. That's greater than the 150 that we want it to be less than. So then our answer choices say you want to increase the statin therapy to a high intensity statin. Okay, we'll keep that option potentially because the lipid panel, the LDL is elevated. Remembering statins bring down the LDL. B, lifestyle modifications. That's an option, but let's look a little bit deeper because they have some significant elevation in their labs. C, prescribe niacin. Okay, yeah, think about it. Usually we exhaust our statins, then go to niacins, the routine. Or D, have the patient return in 1 month to recheck the lab work. Now, of course, we will have them to return to recheck it, but we need to address what's going on right now. And so the main thing that stands out is that the triglycerides are 556, right? That's pretty elevated. So you want to go straight to niacin. You can also do fenofibrates for this, but they're not going to have both answer choices. So here, you want to treat with niacin because if the triglycerides are ever greater than 500, you treat the triglycerides. Then you worry about everything else, okay? So if they were less than 500, you would normally go with your statin therapy. But again, in this case, if it's greater than 500, we treat with the niacin, or you can use fenofibrates, either or. They'll have one or the other. And you also want to consider if they have pancreatitis, so looking into that as well, okay? All right, y'all did great with this. Many of you got the answer correct. I hope you found this helpful. Be sure to share with a friend, invite people over so we can help and study along to get y'all to passing boards. All right, meet me back here next Wednesday.